Hi, my name is Mackenzie. I am the clinic director and owner of Team Rehab in Brookfield, and I am here to tell you today about this new piece of equipment we have, the React table. And I wanted to fill you in a little bit about what we do differently in terms of physical therapy. We take a little bit different approach to our therapy, focusing a lot more on hands-on techniques, including stimulation, which would be the React table, dry needling, manual therapy, cupping, and tissue-assisted work with instruments. So focusing a lot more on the hands-on treatment of the patient's impairments and not just giving them exercises or kind of letting them do some of those more passive treatments. So we are really excited to talk about the React table. It's a very new piece of equipment and new technology. It uses neuromuscular stimulation through a magnet system to stimulate the muscles, and this is one of the only 2 tables in Wisconsin. The other one is in our Tosa clinic. So we are very excited to be able to pilot this new technology. As I said before, the table uses non-invasive magnetic induction to accelerate neuromuscular therapy and to get the muscle contracting. So we have this magnet inside, which creates the stimulation effect to the muscle, and we're able to move the magnet around using this wand so that we can target the specific muscle group for the patient that we're treating, and obviously we can move it up and down on the body as well. The great thing also about the table is that it's non-contact, so unlike traditional e-stim where you have to put patches on the skin, this is a non-contact treatment. The table closes and the patient will just lay directly on top of here, fully clothed, and then we can target those muscle groups. The way the React table works, that muscle can be stimulated up to 4 inches in depth, so you can get pretty deep into some of the more difficult to treat muscle groups with this table, and again, being totally non-contact. So up on the screen, I'm gonna put some different treatment rates that we can use, so we can change the pulse rate on here on the table, and then you can see the different rates that we'll use. We can control the frequency of muscle stimulation. So we have the lower frequencies, which will actually stimulate a muscle contraction. This is good for postpartum incontinence, weak pelvic floor, and atrophied muscles post-operatively. The higher frequencies that we can use, like the 34 hertz and the 50 hertz, are commonly used for pain control. This would reduce muscle spasms, which is good for treatment of back pain postpartum, muscle spasms following an injury. Okay, so by this point, you're probably wondering how this is impactful for your patients. So I'm gonna show you a couple stats. So traditional therapy has demonstrated a 56% improvement in stress incontinence versus only a 6% improvement with no therapeutic intervention at all. In one study, 76 women were evaluated 8 weeks after stimulation. 61% of those women showed a 50% improvement or full cure of leakage in terms of incontinence. The use of magnetic therapy demonstrated a 65% reduction in pad use and a reduction in pad use from 2.5 to 1.3 pads, and of 44 patients, 38% with stress incontinence and 40% with urge incontinence were cured 1 year after treatment. So as you know, treating these patients, I'm sure you hear all the time that they have leakage after pregnancy, or pelvic floor issues, possibly even pain. This is obviously a huge game changer in that realm, that some of these women think that's just normal after pregnancy, and this is a way we could help address that for them and treat these women who are young and shouldn't be dealing with such a debilitating or embarrassing thing as incontinence or leakage for the rest of their lives. Okay, so now I want to demonstrate a few different treatment techniques we can use this for. So one being obviously what you're all here for, which is incontinence and treatment of the pelvic floor. So we'll have the patient in the seated position here on the table, and we can use the different frequencies on the machine like we showed before to get different depths of treatment. So the first frequency I'm going to turn on is the lowest, which is a 2 hertz. That'll be contracting the muscle about 120 times per minute. So we're going to turn it up here as Lauren sits here. And that's the kind of the noise that's coming out of that, is that magnetic impulse being generated. And as you can see here, she's fully clothed, so we can get a depth of 4 inches of treatment into the pelvic floor and stimulation into those muscles with her being able to be fully clothed, non-invasive type. Okay, so here we are doing the same 2 Hertz treatment, but this time I wanted to show it on Lauren's quad, because as you can see, the muscle physically contracting in this video. Obviously, it's a little difficult to see a pelvic floor contract, but I just wanted you to get a sense of how deep that contraction is working and how strongly it can actually contract that muscle to the point where you can see a visible muscle contraction. Again, obviously this is all involuntary muscle contractions for her, so if it's a muscle that's incredibly weak or atrophied, this is a great way to stimulate that muscle into getting a deep contraction without any contact at all. The last treatment I wanted to show you is a treatment for low back pain. So obviously this is something a lot of women postpartum suffer from. One little caveat here is we can't get them on the table until 8 weeks postpartum, but if they are still having muscle spasms and soreness after that, the table would be a great way to treat them. In this setting, we're going to be using the higher frequencies, which is a little lower in depth of penetration into the body, but it's a little more comfortable to the patient because it's such a high frequency of contraction. It feels a little bit more like traditional E-stim. Some patients have said it feels kind of like a deep massage, so this is a very comfortable treatment for a patient who has muscle spasm or pain. So I'm going to turn it up here just so you can kind of see and hear how this would feel. Alright, so again, this is probably a little more difficult to see the actual muscle contraction, but you can hear the machine going. It's a lot faster rate than the ones we showed you before. And again, that's a lot more comfortable for the patient to feel versus the deeper contraction of the muscle. Okay, so that was just a few brief examples of the React table and the treatments we can use it for and how it works. We are incredibly excited about this piece of equipment. I think it's really interesting. I'm aware that you probably have a ton of questions right now, or kind of some questions about how it might work or how it feels. So we'd love for you to come in and try it for yourselves. I think the only way you can truly understand what this piece of equipment can do and how it can help your patients is to feel it yourself. It is pretty awesome to feel how deep that contraction can be and how strong it can contract those muscles, especially in a scenario like the pelvic floor where it's a difficult muscle to get to. So we would love for you guys to set up a time to come in. Our contact information is on the screen right now. If you want to give us a call and set up a time so that we can be here and be able to show you the equipment, we would love to do that, and we appreciate your time and look forward to partnering with you.